Pancreatic cancer has one of the lowest survival rates of any cancer in the world, and a large part of that comes down to timing, because unfortunately, most cases are caught too late after the cancer has already spread. But the good news is that there are 7 early warning signs of pancreatic cancer that your body sends months before a diagnosis. And these signs are pretty easy to dismiss as some other issue like aging, stress, or just not having a great week. Today, I want to walk you through exactly what those 7 signs are, why they happen, and when they cross that line from probably nothing to something serious worth getting checked out for. Let me start with the single biggest warning sign that gets dismissed more than any other, and that is a new onset of diabetes, especially after the age of 50. When someone develops type 2 diabetes suddenly, especially as an older adult, without significant weight gain or the usual progression from prediabetes to full-blown type 2 diabetes, that specific pattern has been associated with underlying pancreatic cancer. The proposed mechanism is that a developing pancreatic tumor can disrupt the normal function of the insulin-producing cells in the pancreas known as beta cells. This causes blood sugar to rise abruptly rather than through the slow years-long progression that's typically seen in standard type 2 diabetes. Now, this does not mean that every new diagnosis of diabetes is pancreatic cancer, and to be honest, the overwhelming majority are not. But if you do have sudden new onset type 2 diabetes developing after the age of 50, this is something you absolutely must bring up to your doctor if he or she hasn't brought it up to you yet already. The second warning sign is one of the most well-known signs out there, but the nuance of it that most people miss is what makes this significant. Sign number 2 is unexplained weight loss, and the key word there is unexplained. Losing weight because you started exercising or changing your diet, or if you're intentionally trying to lose weight. These are not a warning sign. But losing about 5% of your total body weight over 6 to 12 months without really changing a whole lot, well, that's something to take seriously. This kind of unintentional weight loss can occur because a pancreatic tumor affects the production of digestive enzymes, which impairs the body's ability to properly absorb nutrients from food and can also increase the body's baseline metabolic rate. Honestly, if you have this one symptom alone, this is always worth bringing up to your doctor. Sign number 3 is yellowing of the eyes or skin, also known as jaundice. This is one of the most visually obvious signs on this entire list, but the underlying cause is often misunderstood. The pancreas sits directly next to the bile duct, which is the tube that carries bile from the liver to the small intestine. A tumor located in the head of the pancreas, which is the most common location, can physically compress that duct, preventing bile from draining normally. When bile backs up, a pigment called bilirubin accumulates in the bloodstream, producing the yellowish discoloration in the skin and on the whites of the eyes. Jaundice always warrants prompt medical evaluation, since the cause could be a blocked bile duct from a variety of different conditions. But a pancreatic tumor is one of the more serious possibilities that absolutely needs to be investigated. Now, before we get into the last 4 signs, if this video is already starting to change the way that you're going to look for warning signs of pancreatic cancer, please consider subscribing, as it truly does help push this information out to the people that need to hear it the most. Sign number 4 ties directly back to the jaundice mechanism that we just talked about, and it's pale, greasy, foul-smelling stool. The pancreas produces digestive enzymes responsible for breaking down fat in the food that you eat. When a tumor obstructs the normal flow of these enzymes into the small intestine, fat passes through the digestive system undigested. This produces stool that is notably pale in color, appears greasy or oily, and tends to float rather than sink, as well as having an unusually strong odor. This pattern is known medically as staturia. Now, a single instance of this, particularly after a fatty meal, is not something to be concerned about. But if you have a persistent pattern of this over weeks to months, that's a signal that your pancreas may not be producing or delivering the right digestive enzymes that it's supposed to, and that warrants further investigation. The 5th warning sign is one that's very commonly associated with pancreatic cancer, but it's also probably the easiest one to dismiss on this entire list. Sign number 5 is persistent upper abdominal pain that radiates to the back. Now, persistent abdominal pain or mid-back pain can be caused by a plethora of health conditions. But the pain associated with pancreatic tumors is often described as a dull ache in the upper abdomen that can radiate straight through to the back. And it frequently worsens after eating or when lying flat, and sometimes improves somewhat with leaning forward. Now, what makes this pattern worth paying attention to is the persistence and progression of the pain itself. If you have pain that comes and goes with clear triggers, like a pulled muscle or after you eat spicy food, this is very different from a dull ache that persists for weeks, gradually worsens, and does not respond to the usual explanations or over-the-counter treatments. Now, sign number 6 is the least intuitive sign on this list, and it surprises most people the first time they hear it connected with pancreatic cancer. Sign number 6 is a new onset depression or sudden mood change. Multiple studies have found that depression can precede a pancreatic cancer diagnosis by months, sometimes occurring before any other physical symptom becomes apparent. The proposed mechanism includes inflammatory changes in hormonal signaling from the tumor that can directly affect brain chemistry independent of the emotional response to feeling generally unwell. What this means is the first warning sign of pancreatic cancer may just be unexplained and sudden depression. Now, this does not mean that every episode of depression should automatically train your brain to think pancreatic cancer, but it should raise your suspicion a bit. If you've never struggled with depression before and all of a sudden you have new onset depression that's mild, moderate, or even severe, it's definitely a reason to get checked out, especially if you have any other signs or symptoms on this list. Sign number 7 is having a blood clot without an obvious cause. Pancreatic tumors can release substances that increase the blood's tendency to clot. This is a phenomenon that can result in a deep vein thrombosis, which typically presents as sudden pain, swelling or warmth in one leg, or a pulmonary embolism, which is a blood clot that travels to the lungs and can cause sudden shortness of breath and chest pain. This connection between cancer and unexplained clotting has a name in the medical literature, and it's sometimes referred to as syndrome, and pancreatic cancer is one of those cancers most strongly associated with this pattern. A blood clot with no clear explanation, such as a recent surgery, prolonged immobility, or a long flight, is a legitimate reason for a broader medical workup. Now, here's the thing that I want to leave you with at the end of this video. Every sign today covered on its own in isolation may be explained by a different cause other than pancreatic cancer. But, and this is the important part, if you have 2 or more of these signs that have been lasting for weeks to months, then that is a reason to get checked out for something else that may be going on. The real takeaway is this. It's rarely one dramatic symptom that gets missed for pancreatic cancer. It's usually a pattern of several subtle signs occurring together that each one often gets explained away one at a time. Now, if you like the way that I explain things today and got something useful out of this message, and you want to work with me one-on-one as your personal doctor, there's a wait list to be able to do that, and you can sign up using the link in the description below. Also, you can check out all my other free resources linked below as well. Finally, in peace I will lie down and sleep for you alone. Lord, make me dwell in safety. This is from the book of Psalms 4 verse 8. In my next video, I talk about how to activate one mechanism that allows your body to eat its own diseases, including cancer cells. If you want to know how you can truly prevent cancer from ever happening, you're going to want to check out that next video right here. Music.